What does the rapid spread of the Omicron variant and a sudden wave of major COVID disruption tell us about the winter just ahead? President Biden meets with his COVID team today to discuss this moment's public health triple threat: the Delta variant already causing a case surge and a healthcare system strain. New Omicron variant cases are climbing exponentially. And the third piece, the flu, now making an unwelcome comeback. Disruption is again way too easy to find. Cornell, Princeton, and NYU among the colleges and universities shifting back to online learning because of campus outbreaks. Several Broadway shows now closing for the same reason. Plus, the NFL, the NBA, and the NHL all seeing star players sidelined and games postponed. CNN senior medical correspondent Elizabeth Cohen is here with us. Elizabeth, new frustration, new uncertainty.
That's right. And because of this uncertainty, I think that's why we're seeing people move so quickly on Omicron. We keep hearing that it's causing really mostly mild disease, but still there's so much that we don't know about it because epidemiologists and doctors haven't been able to sort of lay eyes on it really in this country to see what it does. So I want to read something that Martha Pollack, who is the president of Cornell University, said about why they made their decisions about moving things online. She said, "While I want to provide reassurance that to date we have not seen severe illness in any of our infected students, we do have a role to play in reducing the spread of the disease in the broader community." And I think she really hit the nail on the head there. Omicron, we're told, causes more mild disease, but still, if it spreads as quickly as we've seen in the UK and in South Africa, that means it could reach lots of people. It could reach people who are immune compromised, who sort of managed to avoid Delta, but if this spreads that quickly, they may not be managed to avoid Omicron, and Omicron may cause mild disease in, say, a healthy Cornell student, but could make an immune compromised person really sick. So I think that's one of the reasons why we're seeing this move to online learning. John?
Elizabeth, you just made a key point. Experts still learning about Omicron. I understand there's a new study about vaccines from Columbia University that raises the question, how are they working or will they work with Omicron? What's it saying?
It's really quite grim, and I'm going to read you some quotes from the study, and then I'm going to tell you why maybe it's not quite as grim as what it sounds like from these quotes. But let's look at this. So what they found in this Columbia study was that Omicron was markedly resistant to Pfizer and to Moderna and to Johnson & Johnson and to the AstraZeneca vaccine, and that Omicron is now the most complete escapee. In other words, of all of the variants out there, Delta and all the other ones, this one has managed to escape the vaccine more than any other. Now, of course, you might be thinking, well, what about getting a booster? Would that help? And here's what they had to say. Even a third booster shot may not adequately protect against Omicron infection, but of course it is advisable to do so. So I want to sort of linger for a minute on that last phrase. The vaccines aren't completely 100% ineffective against Omicron. What other studies have found, and this one too to a certain extent, is that it might not keep you from being infected with Omicron. There are going to be lots of breakthrough infections, but it does have some power. Even 2 doses has some power at keeping you protected from getting very, very sick. And a booster does an even better job. John?
Elizabeth Cohen, grateful for the important reporting and insights. Let's get some more now. Put some of these key questions to Michael Osterholm. He's an epidemiologist and the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Mr. Osterholm, grateful to see you today. I just want to put up on the map, just right now, the map of cases across the United States. The deep red, Rhode Island, cases are up 103% over the past. The 7-day average net change for 100,000 residents is what that shows. If you're red or you're orange, that means you're going up. And that's most of the country right now. To that point, Mr. Osterholm, Dr. Fauci says you should get boosted. The official government policy is fully vaccinated, is 2 shots. Listen to Dr. Fauci explain this is not a big deal.
Well, it's almost a semantic thing. We know what optimal is. Optimal is getting a boost. So instead of worrying about what the definition of fully versus not fully is, I'm telling people, if you want to be optimally protected and you're vaccinated, get boosted.
Is it semantics or is it bad government policy? If optimal is best and best is a booster, 3 shots, why is the government policy still 2?
Well, I think you're going to see that changing over time. We now have a much better understanding of why the booster is so important. And as Elizabeth Cohen just said earlier in this piece, it can have a major impact potentially on whether someone has a serious illness with either Delta or Omicron or a more milder illness. So I'm convinced that this is just a matter of time before this change occurs.
Let's hope you're right about that. I just want to pop up Omicron right now. This is where a week ago it was 0.4% of the cases in the United States. Now it is 3% of the cases in the United States. This is as of December 11th. You can do the math. You can assume by what had happened in South Africa, what has happened in the UK, that this will be 6% within a couple of days. And then a week from now or 10 days from now, it will be 12%. So where's the sweet spot of public policy and personal responsibility at this moment? You heard the Cornell professor, thousands of students, hundreds of students, get the Omicron variant. Should it be wall off nursing homes, protect the vulnerable, tell the immunocompromised, protect yourself, and then let this rip because the conditions are mostly mild cases, or do we need to do more?
John, we don't have a choice if this is going to rip or not. We are going to see a viral blizzard over the next 3 to 8 weeks. It's just that simple. This is a very highly infectious virus, almost like trying to control the wind. So we can do certain things like try to close down long-term care facilities briefly from outside visitors. We can do any number of things like that, but I suspect that within a very short period of time, we could be talking about millions of cases of Omicron infection occurring in our communities.
That's a sober message there. And when you see, I showed a minute ago the map of the cases. Hospitalizations are up. They're nowhere near where they were at this point last year, before we had vaccines. But we have nearly 70,000 Americans in the hospital because of COVID. A month ago, that was 47,000. If you look at it from an intensive care unit perspective, you see New Hampshire and New Mexico, nearly half of the ICU beds have COVID patients. In these states that are darker, it's 40% in Minnesota. It's 39% in Michigan. More and more hospital beds being held up, and as Omicron spreads. I want you to listen to the former Surgeon General who says the country everywhere needs to follow what the sports leagues do so we have a better sense of what's out there.
Kudos to the sports leagues because they are actually doing a fantastic job of surveillance testing. In the rest of the country, we're driving a car down a dark road with the headlights off while looking in the rearview mirror. What we need is a well-articulated, long strategy. We can't keep chasing variants forever.
Is that correct, the surveillance testing point, in the sense that if this is the stress on the healthcare system now, and we don't fully understand both really the current Delta crisis and the Omicron growth, that this system could be knocked over?
Well, I think we have to be a little bit careful here in terms of ascribing what we can do about this surge and not. Number one is we have to understand that what's happening with Delta is already baked into the system. The next 3 weeks, the people who are infected with Delta that will become hospitalized, that will become seriously ill and die, is already there. But I think over the course of the next 2 to 4 weeks, you're going to see a war between Omicron and Delta, deciding who is going to be the king of the viral hill. And I do believe Omicron will probably win. That does, as Elizabeth Cohen also said earlier, has a big implication in terms of less severe illness. And what I mean by that is that if you look at what's happening in South Africa today, the morning data today shows that the number of hospitalizations and the deaths are actually on track with what we saw with Delta. But what happened was the case numbers went up very quickly and now have started to come down already, which means that we will have then fewer deaths overall, fewer hospitalizations than we've seen with Delta. So I think it's early. I don't want to suggest for a moment we're out of the woods yet. I think the next 3 to 8 weeks, again, where we see an overlap between Omicron and Delta, it's going to be really tough. But I think that in the end, we are going to get out of this a lot quicker than we have with these long, month-long, 5-month-long Delta surge events.
Well, to that point, you're learning every day. Science is evolving as we deal with this. Is your advice, whether it's a guy on cable television asking you the question or somebody in line at the grocery store asking you the question, would your advice, what should I do today, is it any different today than it was 3 weeks ago?
No. In fact, the only thing I could say is that why not be different. It surely is a new emphasis. Please get vaccinated. We do know that, in fact, Delta is readily handled by being double vaccinated and your booster. We also know that with Omicron, the data we have from Israel, the initial data from South Africa, you do have a chance of having less severe illness if you get vaccinated. So this same message over and over again, please get vaccinated. Get your boosters. We only have 1/3 of Americans right now who are vaccine willing. They got their first 2 doses. They just haven't gotten their booster yet. Get that. That can add an additional element of protection that you need right now.
Everybody's exhausted. Everybody is stressed in different ways. There's mental health pressures, there's economic pressures, there's public health pressures. Among the economic pressures, the airline industry, all passengers still required to wear masks on airplanes. 2 big CEOs says that should change. Listen.
Yeah, I think the case is very strong that masks don't add much, if anything, in the air cabin environment. It's very safe and very high quality compared to any other indoor setting.
Mr. Parker.
I concur. The aircraft is the safest place you can be. It's true of all of our aircraft. They all have these HEPA filters.
You agree with that? Would you advise they can end the mask mandate on planes?
Well, first of all, I don't agree, and I believe that one of the executives actually walked back their comments already. Number one is that not all airplanes are the same. Some of the older models don't have the same HEPA filters in them that the newer models do have. Number two, we have clearly shown transmission on airplanes. It's limited. I agree that the airplane cabin environment is a better place to be in terms of air, but when you're close to people, next to people who might be infected, and I believe particularly with Omicron right now, you're going to see transmission there. So even if you only get a limited improvement in your safety with a mask, wear it. And I think it would be premature and unadvisable for the airline industry to change that right now.